Hi, Dr. Nurkin. Thank
Hi.
you so much for coming out today. I know you're an extremely busy man here fighting cancer at Roswell Park. Just curious to know where you're from, why you do what you do. So if you can give me a little history on yourself, that would be wonderful.
Originally from Brooklyn, New York, born and raised. I did all my training pretty much in New York. And what brings me to Buffalo is when I was a medical student in New York City, Sai Endamori, who's the chair of thoracic surgery here, was working up at Roswell, and I said I was interested in surgical oncology. He said, "Why don't you come up and visit, Roswell and Buffalo?" I came up as a resident, really enjoyed it here. Then I ended up coming back and doing some additional training, and then stayed on staff here at Roswell, and have been here now for a total of 10 years.
Wow. And the type of cancer that you treat is colon cancer. Can you tell me a little bit about some things, some screening precautions, how people can, try to prevent? What are some signs and symptoms of it?
So colorectal cancer is one of the most common cancers in the United States, but it's also one of the most preventable. So there are a lot of cancers out there that unfortunately we don't have great screening tests for. But colorectal cancer we do. It used to be that dreaded 50-year-old exam that you had to go and do your bowel prep and all of that. Now we're actually seeing that an increased rate of colorectal cancer in younger populations, so less than 50. So a number of organizations, and also here at Roswell Park, we now recommend if you're average risk, you should start at age 45 to get screening for colorectal cancer. What screening entails is often, there are a couple different tests that are available. Some are structurally based, meaning you can get a scope like a colonoscopy, where you do have to get cleaned out for that, and the colonoscopy procedure is where a camera gets inserted and your entire colon gets evaluated. There we can look for small polyps that could potentially become cancer in the future. So it's a preventative exam where these small polyps can be removed and prevent future cancers from occurring.
How long have you been in the area of colon cancer?
Pretty much the whole time I've been here at Roswell, for about 10 years.
As far as research, how important are research dollars to Roswell Park? What does it mean for the community to come together and contribute and donate to Roswell for research?
Yeah. One thing that I've really have grown so attached to is this community. This community rallies. I mean, nothing like I've ever seen before. It really is quite phenomenal. And Roswell wouldn't be where it is today without this community. Of course, the doctors and nurses and staff here get a tremendous amount of credit, but it's not just us. It's our community, it's our patients, it's our families, and of course the donors. We wouldn't be able to do what we do if it wasn't for this unbelievable community.
Amazing. As far as, the 11-day power play, we've had numerous hockey players in the community that have, worked really hard at fundraising, but also fighting and battling on the ice for research here at Roswell. Is there anything that you'd like to say to any of the hockey players out there that do participate?
It means so much to us what you do. Like I said, we wouldn't be where we are today if it wasn't for your research dollars and you going out there working hard. We try to work hard every single day, and we appreciate what you do for us as well.
So Roswell Park just recently was ranked number 14 in all cancer care hospitals in the United States. How does that feel?
It feels incredible. For us to be recognized on a national level, we see how our recognition and how much our community relies on us, and we rely on them every day. But to see that on a national level is just, there's nothing better. It feels great to be recognized that way, and I just look forward to continuing to work here and work with this community. It's just a blessing.
Great. Well, thank you for all you do every day, and thanks for taking time in your busy day to be with us.
My pleasure.